Hey guys, we're back and we're live, and it's the
Health Gurus.
And today we're going to be discussing the respiratory system. How y'all feeling today?
Good.
Okay. I'm Courtney.
I'm Helena.
I'm Makaya.
I'm Zoe.
And I'm Ariel.
And we are your health gurus. Okay, first things first. We're going to start off by breaking down the organs that are a part of the respiratory system.
Y'all hear that?
What's that? Y'all hear that?
It's an outbreak alarm.
Oh my God.
Breaking news, live from our outbreak department. We have Dr. Williams with our latest outbreak at Kenwood Academy.
Hi, I'm Dr. Williams, and the outbreak at Kenwood Academy is a tragedy. We have a rapid spread of coughing and wheezing, and there are several patients down at the facility with severe symptoms and have all been tested and looking for treatment. We advise you to keep your distance and check on your loved ones. I'm Dr. Williams, and that is the latest breakout. Okay, so first organ we will be going over is the nose and nasal cavity.
The nose and nasal cavity houses your olfactory organ, which is like your sense of smell. Your nose also contributes to how you sound when you speak. It's connected to your mouth, which is why it does that. Like, for example, when you're sick or congested in the nose, you sound like different because it like affects how you breathe. But something like really unique about the nose is that your nose cleans the air when you breathe to protect the respiratory tract, which is why you shouldn't trim your nose like frequently or like all the time. The humidity also warms the air to make it moist before it travels to the lungs, just so like it's healthier for you to breathe.
Great. Okay, so next is the throat.
Okay, so basically, the throat is a passageway for air to enter the lungs and also passageway for food and liquids to enter your esophagus. It is located behind the nose to the mouth and connects the mouth, which is also the oral cavity, and nose to breathing passages like the trachea, windpipe, and lungs, and the esophagus. And more than that, your pharynx helps to make sure particles of food and liquid don't tumble into your trachea and your lungs. So basically, some advice I'll give to y'all: chew very thoroughly. Don't choke.
Yeah, y'all, slow down. The food not going nowhere. Slow down. Okay, next is the larynx. The main role of the larynx is to safeguard the lower respiratory tract from food entering the trachea during breathing. Additionally, it houses the vocal cords, serving as the voice box for sound production, which enables human speech. So it's like up in here somewhere. Yeah. The larynx is situated in the middle of the neck and consists of a cartilaginous framework made up of 9 cartilages, along with various muscles that aid its movement and stabilization, as well as a mucous membrane. And next is the trachea. Now, the main purpose of the trachea is to facilitate the flow of inhale and exhale air to and from the lungs. Positioned at the center of the body, it lies just in front of the esophagus. After branching from the larynx, the trachea splits into the left and right mainstream bronchi. The trachea is composed of 4 layers with the point of division known as the carina. In male adults, the diameter of the trachea ranges from 24 to 26 millimeters, while in females it measures approximately 22 to 24 millimeters, being wider at the top and lower at the end. Okay, next is the bronchi.
Okay, so the bronchi, also referred to as large airways, is the main airways into the lungs. With the use of the bronchi, air is able to enter the body through the mouth or nose and has the ability to pass through the larynx and trachea. Beyond moving air throughout the lungs, the bronchi is responsible for protecting the lungs from any possible infections or injuries, which includes viruses, bacteria, fungi, and bits of dust and debris. Even though the bronchi has many layers to it, it is overall made up of cartilage and smooth muscle, which is lined by mucous membranes. The cartilage has the ability to provide structural strength, while the smooth muscles control airway dimensions during the respiration. As the bronchi gets divided into smaller sections, the amount of cartilage decreases and the smooth muscles increase.
Okay, next is the mouth and oral cavity.
So for the mouth and oral cavity, they contribute to individuals' day-to-day speech, allow them to make different facial expressions, and have the ability to eat and drink. With the help of the tongue, food is pushed to the teeth, which allows us to taste the food that we eat. With this, individuals are able to savor every bit of their meal and enjoy it to the fullest. The mouth is lined with moist mucous membranes, which is made up of a palate that contains 3 parts consisting of a front, fleshy rear, and soft palate. A bundle of muscles extend from the floor to help form the tongue. The tongue is covered with tiny bumps called papillae. Saliva within the mouth is used to help the teeth break down and moisten food to make it easier to digest.
Okay, lastly, it's the lungs.
I will be talking about the lungs, and the lungs are a pair of spongy, pinkish gray organs in your chest. Your lungs are on each side of your heart inside your chest cavity. They are the main organs of the respiratory system, and the right lung is divided into three lobes, or you can also call them sections, and the left lung is divided into two lobes. Your left lung is slightly smaller than your right lung since your heart takes up some space on the left side. When you breathe in, air enters your airways and travels down into the air sacs or alveoli in your lungs. Some unique functions about the lungs are the air we breathe contains oxygen and other gases. The respiratory system's main job is to move fresh air into your body while removing waste gases. Once in the lungs, oxygen is moved into the bloodstream and carried through your body. At each cell in your body, oxygen is exchanged for a waste gas called carbon dioxide. Your bloodstream then carries the waste gas back to the lungs where it is removed from the bloodstream, then exhaled.
All right, all right, all right. That's it for breaking down the respiratory system. Next things next, we're going to be discussing lung cancer.
Lung cancer occurs when cells in the lungs grow in an out of control manner. Cancer cells can spread to other areas in the lungs, or they can travel to other parts of the body. Most lung cancers are classified as carcinomas, meaning they start in the lining or covering tissue of the organ. There are several types of lung cancers that vary based on the type of cells affected and how the cancer spreads. Lung cancer is grouped into two categories, and treatments for these kinds of cancers are very different.
Symptoms of lung cancer may not be present in the early stages of the disease. Symptoms that may occur in advanced stages of lung cancer include persistent and worsening coughing, constant chest pain, wheezing, hoarseness, unexplained weight loss, loss of appetite, shortness of breath or trouble breathing, coughing of blood or rusted colored mucus, shoulder pain, bone pain, recurring pneumonia, and bronchitis. If you are experiencing any of these symptoms, please contact your physician.
So lung cancer is treated in several ways, depending on the type of lung cancer and how far it has spread. People with non-small cell during lung cancer can be treated with surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of these treatments. People with small cell lung cancer are usually treated with radiation therapy and chemotherapy. Some treatment options, like definitions of the treatment options listed, are surgery, which is an operation in which doctors cut out the cancer. Chemotherapy, which is the use of special medicines to shrink or kill the cancer. The drugs can be pills that you can take, or medicines given in your veins, or sometimes both. Radiation therapy, which is use of high-energy rays, similar to X-rays, to kill the cancer. Lastly is targeted therapy, which is use of drugs to block the growth and spread of cancer cells. Overall, individuals living with lung cancer tend to cope with complex emotions, have to keep up with treatments, find a support system around them, which can include family or having to hire a healthcare worker if the patient is unable to care for themselves, and simply learn how to adapt with having lung cancer on a day-to-day life.
Now we have a special guest, Dr. Zoe Hopkins, and she will be interviewing her patient that recently just got diagnosed with lung cancer, and she'll be discussing how her life has been.
Good evening. Thank you for joining me, Ms. McCaskey. How do you feel?
I feel, a little weak, a little hurt, chest pain.
Okay. Well, I brought you in today because based on all the tests that we've run and stuff, you've been diagnosed with lung cancer. And basically, the tests were saying that from all the smoking, you've been destroying those tiny air sacs in your lungs called alveoli that pull oxygen from the air you breathe and release carbon dioxide when you exhale. Therefore, you need to be avoiding contact with all cigarettes. And just to be on the safe side, I recommend that you come back into the office next week or later this week so that I can get you started on chemotherapy.
So you tell me, this little video box of cigarettes is killing me?
Well, I've always told you cigarettes weren't good for you, but it was up to you to stop, and apparently you didn't. So here we are.
Okay, so I guess I'll see you next week then.
All right, just a few more questions before I let you go. Like you said, you felt weak. Like how? Like have you been feeling anything else?
So, I've been wheezing a lot. I unexpectedly lost a lot of weight.
Mhm.
I cough a lot, and sometimes, like, when I cough, it don't just be like a regular cough, it be blood that comes out too. And I'm always out of breath. Like, even doing the simplest thing, like laying down or sitting down, I'm always out of breath.
Yeah, those are definitely major symptoms of lung cancer. So you definitely were in the early stages of it, but now you're like, it's serious. So that's why I want to see you next week or sometime this week for chemotherapy. But I'll see you then. Thank you for coming in.
In conclusion, the respiratory system is like a high-speed highway for air, ensuring we can breathe in the good stuff and exhale our worries. However, lung cancer is like an unexpected roadblock. It doesn't just slow down traffic, but it can turn the whole journey into a chaotic detour. So let's keep our lungs happy and cancer-free, because nobody wants a body with a wonderful road trip turned lung ache nightmare. Remember, it's much better to take deep breaths of fresh air than to huff and puff through the hazy fumes of illness.
Thank you for tuning in.
Catch us on the
Catch
next
us on the next
episode of the
episode.
Health Gurus. Bye.
Bye, y'all.
Hi, I'm Dr. Witt.
Stabilize. I'm gonna
want to edit this out.